All right, everybody. We are very excited to be back to drop the daily dose for you again. We hope you enjoyed our first episode, and we're so excited to be back to make our second one today. And today, we actually, it's not just me and Samantha, but we also have our wonderful and amazing nurse injector, Julie.
Thanks.
Hi, Julie.
Hi, E.
Hi, good morning.
Good morning.
So we're rounding up today, and we wanted to kind of talk about something that is in our world, I'd say, a pretty hot topic, the topic of biostimulators. So don't turn it off right now.
Okay.
We know it's a scary word. Biostimulators. What are they?
The wonderful thing is there are a multitude of them.
Ah,
So that's pretty exciting. Makes it a little complicated for the consumer, though. So we're here to explore those things.
tell me, Julie. How are we exploring them? It's early. It's early. It's early here.
I feel
in-
like Saturday Night Live coffee talk right now. I'm having a moment. I'm sorry.
That's okay. We're gonna get to it.
Yeah,
But so
absolutely.
biostimulators,
Yeah, absolutely.
What are they? I mean, let's first talk about what products fall into the category of biostimulators,
Yeah,
just so
absolutely.
people know what we're talking about. I mean, let's list them
for
off.
sure. So Sculptra, which was developed and it was FDA approved in 2004 for assistance with lipoatrophy for AIDS patients.
That means loss of volume in the face. Yeah,
Sorry.
just so we know.
Yeah,
But that's
thanks.
okay.
Thanks. Radiesse, which was FDA approved in 2006, that also was approved for lipoatrophy in AIDS patients. Not necessarily in the way that we use it as a biostimulant now, but they've been around for quite some time. There's another one called Bellafill, which is each are very unique. So we'll get into that a little bit.
Well, the crazy thing about these products is, so just so everybody knows, I'm officially old, and I was around when all this stuff actually hit the market. And it's interesting because Sculptra popped into the market. Like you said, it kind of first really was FDA approved in 2004, but it was a very specific indication. And it's cool because I can actually really remember. I remember being in my office, and I remember this stuff coming in little boxes, and we had just really only started using fillers, I'd say, in moderate volumes at that point. And we were using it very differently than we use them today. We were using it to fill, creases specifically. We were using it to volumize the lips, maybe similar to what we do today. But when the biostimulators hit the market and they came in with this very specific indication, for many years, they kind of stayed in that very specific indication. And I don't think it was really until probably, I don't know, the mid 2010s, maybe even into early 20s, where I think the biostimulators started to fall into the role that we see them today.
I would agree.
Yeah, because I really think that it was, they kind of crept up into that role, but I think now today, they are in a very different, they serve a very different purpose than they did when they first hit the market.
Absolutely.
And I think they're widely used now. And I think we're using them, but the context in which we use them, I think, is interesting because they're very different from the fillers, such as hyaluronic acid. So,
They don't replace them.
They don't replace
have
them.
their role.
Yeah, and that's I think what makes it so awesome.
They're complementary.
Yeah, they can absolutely be complementary. And I suppose that's the hardest thing too. There's not an easy answer. Everyone is so different, and that's where the assessment and the evaluation comes in. And we might use a little bit of both.
Exactly.
Everybody's plan is just so individualized, which is super important.
Yeah, because the fillers really kind of provide, again, you guys correct me if I'm off on this, but I feel like fillers are very good at spot filling areas. They'll add volume in a very discreet and targeted fashion. But the biostimulators, I feel like, do a very different thing. They kind of change the quality and the texture of the tissue while still adding volume, but not in a very discreet and defined manner. I think they're a little bit more of a diffuse volume addition.
So like if we have a 20-year-old who comes in, she wants cheek and lips, I'm not going to go reach for a biostimulator. That would be like a reason to actually still go for your HA. Otherwise, we have someone in between like their 30s, 50s who has laxity. I'll probably reach for that biostimulator.
Yeah, and then there's the group that are prejuvenation. That is, I think, a big thing these
Rejuvenation.
days.
Wow, we just opened up a whole new door right
exactly.
now.
Regenerative aesthetics.
Yeah, absolutely.
Whoa,
So some people, we want to use an HA because we have very specific goals.
Yeah.
Fuller lips, cheeks of a certain appearance. But then again, we want to improve skin quality. I always think about it as kind of whitewashing the underside of the skin with a product that's going to help it be healthier, and just do work because, our body stops doing work.
So biostimulators actually, what they do is they actually promote the production of collagen. And so they're injected, just like fillers. They're injected under the skin into different planes under the skin. And once they're in there, they actually can change the collagen composition. And different products do different things, right?
Exactly,
like, I mean, Sam, we were talking about this earlier when we talk about Sculptra versus Radiesse. I think
absolutely
different.
It is different.
And I think to understand it, we have to kind of understand the collagen composition in the body. I think that I think most people just hear the word collagen and then we're done.
Yeah.
But there's actually a lot of types of collagen, but predominantly there's about 4 types of collagen. And really the main ones in the body are type 1 collagen and type 3 collagen.
Of course.
Yeah. And so it's interesting. So what would be the ideal composition of these collagens in the body? Well, it would be basically our 4-month-old baby, right?
Neonatal.
Yeah. Who has 50% of each, right? They have half type 1, half type 3. And what's cool about that is I don't know if a lot of people know this, but if a neonate in utero has a surgical incision made, it's going to heal scarless.
Yeah.
It's going to heal. And it's almost not, in fact, it's not detectable afterwards. You can't find where that scar went in most cases. So that is the ideal scenario. But after we're born, and as we grow, that composition changes so that in an adult state, our composition of collagen, instead of being 50-50 type 1, type 3, we're now looking at like 75, 85% type 1, and that type 3 collagen level comes down. So these biostimulators actually can help not only produce collagen, but they can also change the ratio of collagen because they can target the type of collagen that's late. Because I think, what was it? I think
hyperdilute Radiesse actually stimulates collagen type 1 and 3. It's the only one that stimulates both.
Which is interesting because, I mean, one would argue that maybe, trying to promote type 3 collagen deposition is a good thing.
Absolutely.
Yeah.
Why wouldn't it be?
So we know these things increase the production of collagen, but what does that do clinically?
I mean, I think that kind of starts to end up sending us down the controversial landslide that I suppose is occurring these
Controversy.
days.
Ooh.
Controversy.
All right, let's jump right into it. The water's hot.
I mean, my concern, not even a concern, but my point is we've been using Sculptra for a very long time. And I'm sorry, but I worked with a surgeon for a really long time and never was he ever. I'm going to stop using that product because it makes my facelifts harder.
Yeah.
Love it. But
So let's highlight that.
Yeah,
so
please.
the biostimulators, they can serve as an amazing tool to help add volume, to help rejuvenate the tissue, I mean, by increasing collagen production. And so they're very regenerative in that capacity. But the problem is as part of that process, some of that regeneration can lead to scar production. Yeah. And so that scar tissue is what sparks the controversy.
Right.
And me, the surgeon, I can say that, it is a concern. There's definitely some concern to be had when we're going into a surgical area that has been previously affected in any way that would make it have more scar tissue. And it's not just the face. I mean, anywhere.
Sure.
If someone's had previous liposuction,
Right.
trying to come in there and then manipulate the tissue, liposuction causes scarring.
Absolutely.
Well, this adding these products into the planes that we put them can potentially add some scar tissue into those areas. But it's kind of a double-edged sword. I mean, I think, sure it might make the procedure technically more difficult, but we could easily argue that it also positively affects the tissue, especially we're talking about increasing the production of type 3 collagen.
Yeah, quality.
Yeah, you have a better quality tissue. So if I'm if I'm trying to tighten, a really lax, very, excess redundant area of tissue versus something that an area where the tissue has been optimized, so that there's less laxity, there's better collagen. I mean, it very, very well could require less surgical intervention. When I say less, I mean the magnitude of what I have to do could be less, or what I do could be better, because then I'm working with better tissue and I can get a better result potentially. So I think the argument's a bit double-sided. I mean, it's hard to say that it would be.
I mean, come on. I'm just saying, when people say, well, it causes so much scar tissue, and you have surgeons who are complaining about that, is that really affecting the result for the patient? I mean, why does that matter to the patient? It matters to you.
Yeah, it matters to me.
What does it matter to the patient?
Certainly it would matter if it would affect my ability to actually perform the procedure, right? If it actually made it, so that I couldn't do what I needed to do, yeah. But I think that when we talk about these products, it's very also important to understand how they were used, right? Yeah. And so if a person tells me that they're getting biostimulators, it might be very important to understand, okay, so where? Where did you have your biostimulators injected? Right. If they're like, in my temples, I'm like, that's not going to really affect my facelift. Right, for sure. But if they tell me, I got pumped full of, Radiesse or hyperdilute Radiesse into my décolletage over and over again for the last 15 years, and I have mid-facial, Sculptra over and over again, I might be a little bit more cautious and understand what I'm walking into, and certainly would probably change how I proceed a little bit. Would it change my decision to perform surgery? No, it might change my timing. Sure. I might say, okay, cool. So let's lay off this stuff for 12 months. Yeah. Let's let the immediate effects kind of calm down. And then I'll walk into that environment. So it's not at least acutely undergoing all those changes.
And it's so important to understand that a lot of times the result that you're getting is because we're causing an immune response. We're irritating tissue. So that very much speaks to what you're saying, is that let's let that inflammation that's happening just chillax so that we know the tissues are maybe not going to be so irritable.
Yeah.
And, you can have a better result. So those things make good sense. I think it's also important to understand that I've used these on people who have had facelifts over the years as a maintenance afterwards. Because guess what? You have a facelift. It's not the end of your journey. So,
yeah, because there's still gravity.
Absolutely. We are going to continue to age. You still need to maintain a really great skin quality.
Exactly.
Yeah, I would argue that in the post...
the facelift does not affect the skin quality.
It does not. No, it has nothing to do with it.
You are
so
correct.
If you're not prepared, and if you don't understand the investment that you need to be willing to make after, then you should reconsider.
Yeah, but I think that's a good point that you raised. We're talking a lot about the effects that these interventions might have before, but understanding what it can do afterwards also, I think, is very important.
Right.
But I guess it also, and really there's really no great studies out there that would really, and again, I think it's because of the timeline. I really don't think we've been using these biostimulators the way we have it. Right. And I imagine we're at a point right now where I think we'll start to see some better studies start to come out and start to give us some real data, at least at the beginning of some. I think we'll start to see some stuff come out that starts to explain the potential pros and cons of these interventions, at least before surgical. But I really think it'd be great to understand how effective they are in the post-surgical period, because I do think that it would be wonderful to have those things afterwards for maintenance, because once we do a facelift, the ideal scenario is that we don't have to do one again.
Right.
And so if we can, whatever we can do, not just biostimulators, but also, because biostimulators are affecting the skin really kind of at the mid to lower levels. We also want to control the outer layer of the skin. So, energy-based devices like we've talked about in the past, but I think that's also very important to have in that setting. So for you guys in your day-to-day stuff, I just wonder, because I think a lot of people probably listening to this are going to be curious, how do you guys fold in the biostimulator usage with your other stuff in your drawer of, tools? Like if you've got fillers, you've got toxin, you've got filler, you've got biostimulators, and then energy-based devices, and then you got surgery. Is that a fair sort of breakdown of what we have at our our fingertips?
Absolutely.
So where do biostimulators, from each of you, I think it'd be great to kind of hear how you guys fold the biostimulators in, and it's probably different based on different patients and stuff. So where do biostimulators enter your practice?
Number one, nothing replaces the other thing. Not one of those things replaces the other. We use them.
So they're complementary.
They're all complementary. And the whole idea of I'm saving up for a facelift, I'm saving up for a facelift. And then you have these patients who come to you and they've done nothing. They want to get on, they want a little bit of tox and they don't want to do anything else because they say, all I want is a facelift. But they don't understand that
their skin.
I want 20 units of tox and I want to look 20 years old again.
Everywhere. Yes. And it's not. The facelift doesn't correct the other things. They're complementary. All of it is complementary to one another. So with the biostimulators, the skin quality, so the texture of that skin changes. Obviously we're doing it to stimulate collagen. So first some tightening. I guess I use it. It's more of like a natural look.
Yeah.
Where do you use it mostly? So where do you find yourself pumping biostimulators?
A way to give some.
I'm just saying, give me the specific clinical scenario where you open the drawer and you reach for biostimulator. What is the case? What is the actual area you're injecting most commonly? Top 3 sites. Where is it going?
I use it in the temples, in the mid-face, the neck. More recently, I've been using it.
The décolletage.
That's great. That's wonderful.
It was perfectly pronounced.
Legs, butt.
Arms, legs, butt.
All over the place, man.
Absolutely.
Just about anywhere.
Full body biostimulation.
Those patients who have that crepey skin. That's really, it's beautiful for that.
Yeah.
How often are you guys folding biostimulators into your sort of treatment plan for your patients? What % of the time, if you had to guess? Anecdotally, I'm not saying specific.
Yeah. My brain says probably 25 to 35% of the time.
So,
it's relatively high, but it's for that rate. I feel like you get over 35 and it's something that you start to pick up on, to be perfectly honest.
So in your patients over 35, it's when we start to kind of see those changes in the skin.
Yeah.
Laxity starts to creep in. We start to lose a little volume. And I think when you're 35, you still haven't really hit the descent of, your fat pads and your facial planes and all that stuff. So I think that's probably, so around 35, you start to fold it in.
I would say it starts to become more likely of a discussion to have. And then now with all of the GLP-1s, we are seeing another kind of patient profile.
GLP-1.
Oh, baby.
What's a GLP-1?
So all of these wonderful weight loss drugs that people are on.
Ozempic,
Tirzepatide, Mounjaro. Yeah, right.
All of them. So the GLP-1s, we have all these, random meds. Everyone's losing weight massively now. And we have, as a result, all this loss of volume.
Absolutely.
And as a result, also, we have skin that's not necessarily just tightening back up.
That stuff doesn't just go.
So how do the biostimulators fold into your management of the Ozempic Face?
So
that's a dose drop, by the way. Ozempic Face.
Ozempic Face. Yeah.
That's a dose drop. I think I like it. Can we use that?
Yeah.
All right, cool. That's official, everybody. Watch out for the dose drop.
Watch out.
So give us the dose drop, Julie, on Ozempic.
Man, yeah. So really fast weight loss does not allow your body to kind of modify itself in a way. So we end up with all this hanging skin. You're also not only are you causing fat loss, you're causing muscle loss. So this is being even more affected all over your body.
Further devolumization.
Including your face. So I am always looking for something a little bit more. We'll call it pan-facial when I'm dealing with someone who's had a great weight loss. But maybe they've also had a trauma in their life, that they are having a big weight loss. Or maybe they had a jaw surgery or something like that, and they couldn't eat for a month other than liquids.
Nothing like a broken jaw to lose some weight.
Really I know, right? Or, a sickness. So we want to globally address that situation, because if we're choosing to just do a cheek or just do a jawline or something like that, they're going to look very angular and very structural, which is not very natural. For some people, it is if they come in that way. But we want just an overall restoration to help them look healthier from our perspective, but also for them to feel healthier, because they are feeling healthier in the grand scheme of things with all the GLP-1s. They have a new lease on life. They're excited. They're moving. They're taking care of themselves. But then sometimes what we see is not reflective of that. So we're trying to make that reflection be more in alignment.
So when you guys are like developing the treatment plan for your patients, whether it be, your GLP-1 patients, whether it's whatever the case, where in the timeline do the biostimulators start to kind of enter the picture? Is it something out the gates that you start with?
Sometimes.
I
think it's number one, they want some kind of immediate gratification. I'm not gonna lie.
And that's an important topic. So these products
are not immediate gratification.
Except for Radiesse, which can also function as a bit of a filler.
Correct.
But also has the long-term effects of giving you some of the changes like collagen production.
Yeah, absolutely.
But that's a key point.
Yeah.
Is that these products don't expect to walk out and have this wow change.
Right.
Yeah.
Absolutely.
And this is a series, and this is an investment. And you also need to be committed to doing the series. If you do a single treatment, depending on your age and comorbidities and things of that nature, you might not appreciate the outcome versus you need to be committed to the series, understanding that these things are going to build on top of each other. And this is a slow roll. That's all there is to it.
Yeah.
So when would you start with your weight loss patients?
Very good question, right? We really kind of want you guys to be like on a maintenance dose, right?
Yeah.
Having gone through that, because we cannot anticipate where your volume loss is going to be, right? That's just up to Mother Nature.
And everybody loses and gains fat in different places. We all know that well. I mean, everybody.
Absolutely.
If you've gained or lost some weight, you know how that works. So.
Yeah, we're all different. Yeah, I think that's a great one because I think sometimes then you can overcorrect.
Yeah, absolutely. Yeah. And we would just want people to feel their best. So we need to address it appropriately.
Absolutely.
I think that as we think about biostimulators and where they fit into this picture, are they safe? Absolutely. Are they something that everyone should have? Probably not, but it's definitely worth considering in all cases.
Yeah.
Sam says yes on everybody.
I know, right?
Yeah. So the majority of your patients.
Majority, yeah.
Okay.
Yeah. And I think the other important thing to understand is it's not just Radiesse and Sculptra. There are a few other things, and we can't even make autologous fillers that are going to be a biostimulator as well.
Whoa. Julie just did the drop. Autologous?
But for those that are too scared
Autologous.
of putting, a foreign body in their body, we can make something that's made of your own blood products, and it's going to act like a biostimulator as well. So don't just count it out.
Yeah, absolutely. I
So
think that's important.
just to be clear, the things that are made of our own stuff, there's PRF.
Easy Gel.
Easy Gel.
Easy Gel. Yeah.
What's that, Sam? What is PRF Easy Gel? Is it platelet rich? I can't remember. Yeah, good.
Thanks.
So platelet rich fibrin. So what that means is that you guys basically take a blood sample, you spin it down in a centrifuge, you pull out the whatever we're looking for, right?
Yep.
Platelet rich fibrin, platelet rich
And
plasma, albumin, and then you actually concentrate these products into a syringe, and then you use that as the biostimulator.
Yep.
That gets re-injected into
Absolutely.
specific places where it then proceeds to have the effects very similar to the products we're talking about.
Yeah.
It can stimulate collagen production. It can restore volume over long term. And so the fact that there are some autologous, or
Love that word.
I guess a simpler word would be natural and your own, because it's made from you. So that's a really good option when we're talking about trying to keep it natural. And if you're really focused on not having stuff come out of a box and go into your body, that's a beautiful option.
I think it's important to know there's more than one. We use some in certain areas more than others, and how long it lasts and how many sessions you need. Like, these are all factors that go into why we would choose one over the other. So there are many options that we can kind of pick from.
I just thought of something, and this might be this is off script. So we actually don't have a script, but this is off script. And so what I think we should do, I just turned 50.
No way.
And I have really actually had very little, if anything, ever done to my facial skin, ever. Like, I have had spot laser treatments, never a full facial laser treatment, right?
Right.
I've only done my scalp for hair. I've had toxin, but not in a year, because someone I know was pregnant and couldn't do it, so I couldn't do it.
I mean,
Look at that anger. I shouldn't be able to move my head this much.
Intense, man.
But all joking aside, like I've had very little done. So I think it'd be really cool to use me as a test sample. And why don't we just use me as a model? And we can, for all of our listeners and all of the people that subscribe to our social media stuff, why don't we start a fully natural and non-product based process that involves only, but well, I am going to say I demand toxin. So,
I was going to say, like,
if I have to go and extract botulinum toxin from honey or something, I'm going to do it.
You're fine. Don't be silly.
But toxin will leave. But I'm talking about in terms of rejuvenating stuff. In terms of how about we just stick to naturally based or autologous based biostimulators, PRF, PRP, and energy based things that I don't put in my body, but rather deliver, right? So like laser treatments of any variety and even potentially.
Too.
I had Tixel. I had one round of Tixel on my lower lids.
It looks good.
We can do more. But I think starting at this point right now, I think it would be really fun to do that.
Yeah, we can even do a live demo.
Oh, I think. All right. So maybe at one of our upcoming podcasts, we will start the Dr. K journey with autologous, natural-based interventions to see if we can make me look 25 again. All right, fine. 35.
Okay, there you go. Challenge accepted.
Sounds good.
How about 40?
Yeah.
But, okay.
So the dose drop for the day, before we drag this on and on, because I feel like we can talk for hours about this stuff, but I think just to give all of our great listeners the dose drop. Is that what it is? Is that the phrase? So I think we can say that biostimulators, we all agree that biostimulators are an essential component of the sort of full picture of how we care for our patients and their journey in terms of maintenance of their care and rejuvenating their tissue. Fair?
Fair.
I think it's also safe to say that certainly these products can cause some changes in the tissue that might make interventions down the road, surgical interventions down the road, potentially more, slightly more difficult for the surgeon.
Sure.
But I would say that they also hold the potential to actually make the tissues more favorable in terms of optimizing the result. But also maybe even... It
hasn't stopped most surgeons from doing the surgery.
It hasn't stopped any surgeons from doing the surgery.
Right, they're still cutting.
Clear.
Yeah.
They're still cutting.
Yeah, but again, for our surgeons who are listening, I think it's just, the take-home message is be smart. Ask people what they had, when they had it, and where they had it, right? And have a clear understanding. Sometimes it doesn't even matter. I mean, if they just say that they have biostimulators, doesn't necessarily mean it's going to be a problem for you. And then I think it's also safe to say that, maybe in some select cases, it might even take away the need to have a facelift at all, because some people don't really want to do that. They're expensive. There's a ton of recovery. I don't know. I mean, I think in some cases, maybe if people get enough of a result, then they may not necessarily jump in on the OR table and get under the scalpel.
Or delay it.
Potentially. Yeah.
And I mean, it's just not in the cards for everyone. And that's understandable.
Absolutely.
We're here to support it either way.
Yeah.
Absolutely.
So.
All right. Well, so the take-home message is going to be that biostimulators, thumbs up. And what's to come? I think that what's to come is we're going to watch me undergo a very natural and autologous regenerative series of interventions that will hopefully make me look 35 again.
Regenerative.
I'm so excited.
Baby.
Let's do it.
I'm so excited.
Yay.
All right. Well, thanks for listening.
Thanks.
We're really glad you tuned in, and stay tuned for the next Daily Dosed episode. Remember, they're not daily, but they're more like weekly.
Often enough.
But if we can keep these going fast enough, and like we said before, if there's any questions, if you guys have any thoughts or want to hear about specific topics, let us know. We're always ready to change the list of topics we have on our agenda. We want to give you what you need. Thanks for listening.
The content of this podcast is for educational and entertainment purposes only. Although we are licensed medical professionals, nothing discussed in this episode should be taken as medical or legal advice. Always consult with a qualified provider regarding your own health or treatment. We do not accept any liability for decisions made based on the information shared here.